we really ought to have a conversation about what are the goals of health in this country? Because the bigger issue, we're talking access, we're talking lifestyle, we're talking burnout, we're talking all that, but what are the goals of health? So earlier there's a dissing of a single payer system. If you look at the overall health of countries, you probably all know this, we're 39th. We're the worst in developed countries. We're the richest country that has the least amount of health by all the accepted measures of looking at health. And we do know that the ones that are up 1 through 10 have some sort of a system where everybody is covered. And it's not all single payer, like Germany is one of them. Now, I can't describe Germany's system, but they enjoy very good health there. There's a lot of reasons for that.
Here.
Dael, you just opened up a whole
I know that
important topic.
I know I did.
I'm going to try and kind of give you my little version of this from my perspective. And this is in the course of my career, which is 26 years. And I think really the key question is what, are we talking about healthcare? Are we talking about a healthcare system or the overall health of our people? So back in 1996, I'm in my first year of training, VA in Philadelphia. We had 16 million people with diabetes in our country. We had in the wound care world, we had about 300 to 500 products. We had no wound vacs. We had no endovascular procedures, no cellular tissue products, on and on and on. And so here we are in 2021, we're up to 34.2 million people with diabetes. Our amputation rates have gone up since 2009. And so I say, despite all these advances in healthcare technologies and our know-how, we're failing, and we're failing miserably. And I don't know how do we solve this other than changing people's behaviors on the front end and driving this into a preventative type of model. And can we figure out a way to incentivize people beyond scaring them, scared straight? Because it's a terrible thing what I'm witnessing, and I'm so frustrated now because I feel like I've failed. I feel like my contributions have been for naught almost. Anyway, I just wanted to throw that out there because I think, Dael, you posed a really important, bigger question in all this. It's, paying is one thing, and but here we have a system. Do we blame the system, or is it the health of our people that is really, this is the real problem here?
I'm not you guys, and that's obvious. And I like Dael. I feel what Dr. Waxman does. He hangs out over there, and he either's a pretty good listener or a pretty good faker. And then he throws out these bombs like this now that set the whole thing off. So that's pretty crafty, Dr. Waxman. What I would, well, I agree with everything he says, what Dr. Waxman says, and I hear you too, Dr. Bell. So, I mean, again, if you, and you really want to get back to it too, there's, I think, 170 million Americans that get their insurance from their employer. The employers, I could very well argue, put myself out of a job. Why are they in the health insurance business? And, it was the World War II wage freeze is when healthcare came out and they started paying for it and got to write it off as a tax deduction. But should they be? So when you look at that, you got the Medicare and Medicaid, you got all the Medicaid patients, to your point. You have a lot of uneducated, socioeconomic disadvantaged people that are, obviously ridden with chronic diseases because they've never gone to doctors. And if they do, by the time they get there, they're in such bad shape. So I don't know how you fix that. All I can speak to is looking at it from an employer group. So I will give you all a few statistics. So if I was to take on Rhonda's, company with 300 employees, and then how many you got, Rhonda?
Yeah, about that.
Why aren't we talking? Why haven't you hired us yet? I don't get it. Okay, because you heard the podcast. That's probably all right. But here's what I would say: 10%, to Dr. Bell's point, are diabetics. 10%. Okay. So what do diabetics do? What have we done as a country? They don't get their test strips. They don't take their insulin regularly. They don't do a lot of things. So what do they end up happening to them? They become an ER admit, and they become an inpatient admission. And I don't think I need to tell y'all anything more about how much that costs. And if you hadn't seen, the average COVID patient today is ringing the register at a tune of $317,000 to these hospitals. $317,000, the average COVID patient in our country. All right, so you know where I'm going. So as an employer, I got to keep them out of the hospital. So what we would do is, to your Dr. Bell, you want to change behavior. Dr. Waxman, you talk about behavior. If the employee will meet with a community pharmacist for 15 minutes a month, then the pharmacist can synchronize all their meds and their test strips for free. And that member now can take care of themselves and they're already a diabetic. So at least accommodate it and deal with it. But now you made it affordable. Y'all have hit on the socioeconomics of this country is the problem. Randy, you talked about Dr. Cook, sorry. You talked about all these people how are we going to take care of the poor people? So that's one way you can fix that and break the barriers to care. And if they don't go to the community pharmacist or the doctor, whoever you want to put it to, but the pharmacist is the one giving the meds out, then they pay full price for what they have. When you build plans with dollar incentives, I'm telling you, the people follow the money. They just got a raise in that program that if they were paying for their meds, they were having to pay out of their pocket. So I don't know if that helps, Dr. Bell, with what you said, but I'm just giving you examples of what can be done on this side. And the problem is y'all's side doesn't understand our side. And that's the biggest disconnect, in my opinion, is you think that people like me, at least they try to dress nice or look good or whatever, but all they're doing is selling insurance. That's not what we do. We build plans that benefit members, benefit doctors, pay you better than the BUCAs. That's Blue Cross, United, Cigna, and Humana, in case y'all know what that stands for. That's the BUCAs. We want to pay the doctors better than what the BUCAs pay them. The doctors are the most important person in the system, and the patient is way out here on the periphery. We got to bring that patient back in, but you have to build plans that are patient-centric. And right now, the plans aren't patient-centric.
Thank you so much for joining us for this discussion today. If you'd like to learn more about our guest, head on over to our Patreon page, where you can access exclusive content, including the full segment of our show. Never want to miss an Inside the Doctor's Lounge clip? Be sure to click the subscribe button to our MD Coaches YouTube channel. As always, we appreciate suggestions for future show topics. Let us know what you're thinking in the comments below. And finally, special thanks to Ryan Jones, who created and performs our theme music for the show.